This is the core exercise. We're trying to engage the core muscle that's going to stabilize our lower back spine. Previously, we used to teach a patient and give them a lot of instructions, but here in this video, we wanted to make sure that you take home those messages and have a very good idea with regards to how to engage the proper muscle. So, first you lie down on your back, and you have to be in this what we call the resting position with your knee bent like that, okay? And so the core, you gotta know, is not your abs. It is a deep muscle underneath your abdominal muscles, and deep inside those core muscles are pretty much your spine and your intestine and your organs, okay? So that's a very deep muscle. It is a stabilizing muscle. When it engages, it stabilizes rather than moving anything, okay? And so what you wanted to do is you want to use your fingers to feel them, okay? When you engage them, you need to have a cue in your head, okay? So the cue that we commonly use, and we found it quite effective, is to draw the belly button down towards the bed, okay? Directly draw it down towards the bed. That's all. There's no need to tilt your pelvis in a certain way or breathing in a certain way. No. When you do this core exercise, you breathe normally, okay? There's no deep breath, and there's no sucking in, okay? And there's no tilting of the pelvis. It's a pure belly button draw down, directly down towards the spine, okay? And so I'm going to get my fingers, and I'm going to try to feel the core muscle. And where can you feel it? You can feel the muscles sort of 2 fingers in and 2 fingers up, just a little bit, with respectively from the pelvic bone. So if you feel on the side, you can feel the pelvic bone, the pelvis. If you go 2 fingers in, just about 2 fingers in, 2 fingers up, that's where you can feel the core muscle the best, okay? All the other areas are covered by your abs, okay? So you wanted to feel at that area with 2 fingers and gently feel on them. You want to start off relaxed completely, and you can feel that there's a hollow underneath your fingers. Now you wanted to engage them by having that cue, draw the belly button down towards the bed, okay? And as I draw down my belly button, I can feel the hardness bulging out against my fingers, okay? And it should be very apparent, okay? For those of you who doesn't feel it, okay, you need to practice. Keep using that cue, okay? Draw the belly button down, and you want to feel some sort of a gentle hardening underneath your fingertips, okay? And while I talk to you, that muscle is hardening, okay? Those muscles are stay hardened, okay? And now I relax. Why? Let go of my belly button. You can see my belly button start to flop and bulge out, okay? I can feel a good hollow underneath my fingertips again, okay? I'll do that again. Draw the belly button down towards the bed, and now I'm going to feel through my fingers. I can feel that hardness underneath my fingertips, okay? And you should have about 40 to 50% effort, okay? So you don't want to go 100%. You don't want to really suck your belly button in. No, you don't want to do that. You just want it to have a gentle drawing in, and you want it to hold. So how do you know that you're holding the core muscle activated? Well, you feel it through your fingers, and that's why fingertip feel for feedback is very important, because it's telling you that you're engaging the right muscle, okay? The idea is to see if you can engage them, keep it hardening for about 20 seconds, okay? So you concentrate for about 20 seconds, okay? And then after that 20 seconds, you let go of your belly button, and if you can feel a good hollowing underneath your fingertips, then that means you are turning on the core muscle correctly. That's very good, okay? I'm going to do that again. Draw the belly button down towards the bed, and I can feel that hardening, okay? My fingertips cannot dig in more, okay? It's very good. I hold, and I focus on just gentle, normal breathing, okay? I'm not tilting my pelvis, I'm not engaged my pelvic floor. The only cue that I have is imagining the belly button drawn down towards the bed. Well, really, I am doing it, drawing the belly button down towards the bed, okay? And I relax. That is grade 1. I want you to master that grade 1 first. There are other variations such as this. So you draw the belly button down towards the bed, and this is an upgrade. Okay, right, once you found it very easy to engage the core muscle, you can improve it by having a different variation. So you can lift your leg up, okay, and all that while you want to keep the core muscle engaged, okay, and bring it down. As you bring it down, you do it slowly, that transition phase. You don't want to lose that hardening of the core, okay? Okay, and then try the other leg, keeping your pelvis and everything stationary and keeping your belly button down, okay? You want to have that steady firmness underneath your fingertips, okay? Another grade above is to bring that leg up and another one up, all in the same time. Hold and keeping your belly button down and still feel that firmness underneath your fingers, not losing them, okay? You want to hold it for about 10 seconds and bring it down slowly, keeping that belly button down, keeping that core muscle turned on, slowly down with the legs through that transition, keeping that core on, okay? And then once you brought everything down, you relax. So that's an upgrade to the core muscle that we teach you normally.